Hello, my name is Dr. Sharad Gupta and I'm a co-founder Identity Plus Dental Clinic. Today I'm going to talk to you about how to take care of your teeth and gums. What are the best dental practices and what problem can happen if you don't take care of your teeth and gums. So I would like to begin by explaining you how to select the best toothbrush. Well, frankly speaking, there is no best toothbrush. All toothbrushes are good. But when you go to market or order online, you have to keep certain points in your mind. First and the most important thing is that the handle of the toothbrush should be sturdy and comfortable to hold. Secondly, the head of the toothbrush should not be very big and wide because it needs to reach every part of your mouth. So you should select a moderate head of the toothbrush, and if preferred, it may have some angulation. Toothbrush is made up of nylon and they are arranged in the form of tubs. So some companies provide zigzag configuration, which is totally fine. You should select a medium configuration, a medium hardness toothbrush with a sufficient length of the handle, so preferably angulation of the head and a moderate height and width of the toothbrush so that it can reach to every aspect of your mouth. Well, my favorite is always an electrical toothbrush because that gives you a total freedom, and the newer variety comes with sensor that gives you a beep when you have finished cleaning your teeth in a particular quadrant for say 30 seconds or 1 minute. So every 30 seconds they give you a beep. So it means now you go to the other part of your mouth. So that way you are able to remember and calculate how much time you have brushed and you have reached all aspects of your mouth. So this is all about the toothbrush. I would also like to tell you how we need to place the toothbrush over the teeth. So this is a model which shows us how our teeth are, and normally we have a practice of keeping the toothbrush horizontally on our teeth and gums. Well, this should be discouraged. We should try and keep the toothbrush bristles at an angle of 45 degrees over the gums and the teeth margin, and then we should start brushing so that the upper teeth are brushed downward and the lower teeth are brushed upward. And we should avoid brushing in a horizontal stroke in and out, and we should also use a moderate pressure. Using too much pressure can cause gum recession and wear of your teeth enamel. Similarly, for the front teeth, you should brush upper teeth downward and the lower teeth backward. For the top portion of the teeth, you can brush in and out with a light strokes, and similarly you should always clean the inside aspect of the teeth. For the lower teeth, you should again brush upward. For the upper teeth, you should brush downward. So this is the part, the inside part of your teeth is the most common part that is neglected. Front teeth, you should brush outward and upward. For the upper front teeth, you should brush downward so that all aspects of the teeth are clean. Now I would also like to talk to you about what type of toothpaste are basically required. So basically, for the purpose of understanding, we have to remember that toothpaste is basically helping you to create a freshness in your mouth. The main action is that of toothbrush because it is mechanically removing all the food particle and bacteria by nylon bristles. Toothpaste are of two types. One in the form of tooth creams or gels. They are basically helping you create a feeling of foaming that helps to emulsify all the bacteria and deposits in the mouth, and you are able to get a fresh feeling. Sometimes the toothpaste may be medicated. It may have strontium fluoride, sodium fluoride as prescribed by dentists to help you to fight with the bleeding gums and or teeth sensitivity. Depending upon what is your challenge, your dentist may prescribe medicated toothpaste. But whatever we are using toothpaste, we should always remember that for adult, the toothpaste should have at least 1000 parts per million fluoride content. So this not only helps to make the tooth structure strong but also prevent development of cavities. For children below 6 years, the fluoride content should not increase more than 500 parts per million. So this has to be watched for. Now there is also a new type of tooth creams available. For example, they are called as tooth remineralization cream. These contain certain minerals in the form of tooth creams that is used instead of normal toothpaste, and It helps to increase the mineral content of the teeth so that one's teeth become strong and more resistant to decay. So this is all about toothpaste. One more important point is that when we are applying toothpaste over the toothbrush, we need not cover the entire length of the toothbrush. We need to take only a small pea-size amount that needs to be first applied and carried in the mouth and first applied over all the teeth, and then circular motion should be used. It should not be first carried and immediately you should start rubbing. In that case, the toothpaste will be only available on the front teeth. So we should take the toothpaste, dab it over the teeth, all the teeth. Once we have applied over all the teeth, then we can start massaging it over the teeth. Always remember, one important tip is that the toothbrush should always be wetted. It should not be dry once you start applying it over your teeth, because it can cause trauma to your gums and cause your tooth wear. Also, important is that when you brush at the back part of the mouth, we slightly closen our mouth, because the cheek muscles will become relaxed and the toothbrush can go till the back of your teeth. If you open your mouth and brush, then the head of the toothbrush is not able to go till the end. Most of the time, your back teeth side surface or the cheek surface remains untouched and is more prone to development of cavities and decay. That is why most of the time molar teeth needs treatment, and they are more commonly seen that they get root canal treatment requirement. So these are the few tips for the toothpaste and toothbrush. So now it is time to know something about dental wax and interdental brush. They can be part of your daily routine besides brushing 2 times a day. So dental floss is basically a nylon thread that may be available from different companies, and all are good. So you should use dental floss which is waxed and pull out at least sufficient length. So this 1 feet of length is good, and try to entangle it over your fingers like this. So you create a nice actionable thread with the dental floss, and now you can start taking it. It is used to clean the contact between the teeth. So try and pass the floss between the contact between the teeth, and once you go to the contact, you feel resistance. Try and push it slightly beyond the contact and go to one surface, and then come to the contact, go to the other surface. Similarly, you can come up. The dirty floss is folded on one finger and the clean floss is now freed, so that you can now go to the next tooth and do the same thing. So the purpose of floss is to clean between the contact area or between 2 teeth. Remember, when you first begin to floss, you may get some bleeding, which is totally normal. Don't give up flossing if you want to stay your teeth healthy, especially once you have passed your adolescent stage. So this is all for dental floss. I would also like to talk to you about interdental brush. When the space between your teeth have becoming more because of gum going down due to pyrrhia or plaque, then interdental brushes are required. Now the space between the teeth is more, so dental floss may not work. So you need something like this that can go between the teeth, and you can push them through the contact point and clean like this in and out. So all the food particles and debris is nicely removed. This way you can safeguard and achieve a complete care for your teeth and gums. So to conclude, the best practices for achieving a good dental care and health at home is by following. First, to have a good toothbrush and brushing 2 times a day. Remember, nighttime brushing is very crucial and you should never skip it. Always use a fluoridated toothpaste. Never use gel based toothpaste. Always use creams. If your dentist have prescribed a particular toothpaste, use it for the time period it is prescribed, then switch to the regular ones. Keep on changing your toothpaste after every 3 to 4 months. Don't stick to one single toothpaste. As the effects start stopping, as the benefit stops after certain period of time. So that is why you should discuss with your dentist which is the paste you can use for long term. Tooth remineralization creams can be used for long term as they increase the mineral content of the teeth and prevents decay. Toothbrushing should be followed with dental flossing and interdental cleaning depending upon the gaps between your teeth. You should make them an essential part of your daily dental care. Don't forget that when you are brushing at the back teeth, always close your mouth so that your toothbrush can reach to the most difficult areas of your mouth. If you need to clean your tongue, then you can use the same toothbrush to scrape your tongue. Don't apply very hard pressure, otherwise it may bleed. Gentle cleaning with the brush is more than enough. Nothing else needs to be done for cleaning for your tongue. Drink plenty of water and practice low sugar diet as far as possible so that you maintain your teeth and gums for life. Here's all to the best dental practices for the healthy mouth. Thank you.